In severe cases, those with COVID-19 say they feel like they're drowning. You can hear this patient struggling to breathe.
It wants to take all the life out of your lungs.
Ventilators offer oxygen. That's why they're in high demand. But critical care doctors say many patients placed on these machines don't survive.
The outcome for a patient who has to be ventilated if they have COVID-19 is horrific.
Chinese researchers studying critically ill patients on ventilators in Wuhan found in a group of 32, only one person survived. Another study from Wuhan suggests about 20% of patients on ventilators recover.
There are risks both to the patient and to the healthcare workers that are involved.
If we could get some intubation medications.
Doctors and nurses can be sprayed with virus while placing a patient on a ventilator. A delicate part of their job is to carefully guide a scope down the patient's throat, then lift a small flap of tissue to make way for a breathing tube. Once connected, the ventilator often blows in 100% oxygen. The average room air is 21%. After several days on a ventilator, high levels of oxygen can become toxic, damage the lungs, and lead to other serious complications.
You got to be pretty sick in order to need a ventilator. It's going to take a while for their lungs to get better if they do get better.
Early North American estimates show about 6 out of 10 patients on ventilators are surviving. They're often younger and do not have underlying health conditions.
So that raises the big question. Do you cherry pick people who you think are most likely to survive?
Right now, most provinces are developing rules in case doctors are forced into that situation. Christine Birak, CBC News, Toronto.